Hello, and welcome to our podcast concerning blood vessels and hemodynamics 1. This is the second part of the cardiovascular system, as the slide says, so that means, of course, the cardiovascular system includes the heart and the blood vessels. So cardiovascular system part 1 was about the heart. Cardiovascular system part 2 has to do with blood vessels and hemodynamics, which is just hemodynamics is movement of blood. So if you look on the left side of the cartoon, you see the artery, and then you see the artery morph into a capillary in the center of the screen, and then on the right-hand side of the screen is a vein. And then it's got the different tunics or layers of the blood vessel wall. The tunica intima is the innermost tunic that has the endothelium in it, and the endothelium, of course, are endothelial cells sitting on a basement membrane. And then the tunica media contains the smooth muscle. There's also some fibroblasts in the smooth muscle layer, or the tunica media layer, and those fibroblasts make collagen. And of course, the smooth muscle in the tunica media, or the middle layer, those cells cause vasoconstriction and vasodilation. And then the outer layer of the blood vessel wall is made of connective tissue, which is usually collagen and elastin, and that layer is called the tunica externa or the tunica adventitia. So let's look at these layers one by one. The tunica externa, like I said, is called the adventitia, and you see these blue arrows showing the tunica adventitia on both the arterial side, which is the right side of the cartoon, and also in the venous side, which is the right side of the cartoon. And then there's obviously no tunica externa in the capillaries. So this outermost layer, the tunica externa, is in all blood vessels except capillaries. And it's made of loose connective tissue, collagen and elastin, and it has its own blood supply. So if you look at the cartoon, and you can see those that red arrow on the right side, the left blood vessel structure of the artery, you see that red arrow pointing into the lumen. So that blood that's traveling in the lumen of the blood vessel is carrying oxygen and glucose, and the oxygen and glucose can get to the cells that are immediately around the endothelial cells. So the oxygen and glucose can diffuse out through to the endothelial cells and also to some of the inner smooth muscle cells and fibroblasts. But really in the larger arteries and veins, that blood from the lumen can't diffuse all the way out to the tunica adventitia to supply those fibroblasts in the adventitia that are making collagen and elastin with oxygen and glucose. So the tunica adventitia needs its own blood supply called the vasa vasorum. So the next layer is the tunica media. You can see I've got big blue arrows pointing to the tunica media in both the arterial side on the left side of the cartoon and the venous side on the right side of the cartoon. And then obviously in the middle of the cartoon where the capillaries are, there's no tunica media. So they call it tunica media, aka the tunica muscularis, or just the muscularis, because that's where the smooth muscles live. And remember, smooth muscles cause vasoconstriction and vasodilation of the blood vessels. The largest arteries have the biggest muscularis. Hint, that could be a test question. So just quantity-wise, the larger arteries have more vascular smooth muscle cells, but the smaller arteries, the arterioles specifically, for their given diameter, which is a small diameter, the arterioles have a greater relative number of vascular smooth muscle cells. But overall, in the larger arteries, there's just a larger number of vascular smooth muscle cells. So in most blood vessels of most of your tissues, the vascular smooth muscle cells have alpha adrenergic receptors that will respond to epinephrine and norepinephrine when you're in a sympathetic nervous system situation. This leads to vasoconstriction which leads to leads to a decreased blood flow, or BF, decreased blood flow to that tissue. If, however, you're in a sympathetic nervous system situation, epinephrine and norepinephrine is looking to find receptors. If epinephrine finds a beta-adrenergic receptor on vascular smooth muscle, that vascular smooth muscle would most likely be in blood vessels of the coronary vessels serving the heart and the blood vessels serving the skeletal muscle. And that makes sense if you're in a sympathetic nervous system situation. You want to vasodilate your blood vessels in your heart and your skeletal muscles so you can fight, flight, flee, or fornicate. And then you can decrease blood flow using alpha-adrenergic receptors to your other tissues besides your heart and skeletal muscle. The media in general is the thickest layer of the three tunics, so the tunica intima, the media, and the adventitia. The tunica media is generally the thickest of the three tunics, but the tunica media is thinner in veins relative to arteries. So a little bit more on the tunica media. Like I said, in the tunica media we have vascular smooth muscle cells, but there's also fibroblasts in there that make collagen to give blood vessels strength, and it can help the blood vessels respond to pressure variations. Fibroblasts also make elastic fibers in the tunica media to allow for stretch of the blood vessels. So if you think the big pulse of blood is coming out of the heart, your arteries are going to have to stretch and then recoil. So like an elastic band, you can stretch an elastic band, but then if you let go of the elastic band, it will recoil. It's the same concept in blood vessels. Also, there's the IEL and the EEL, or the internal elastic lamina and the external elastic lamina. Those are those are two different added layers of elastic tissue in arteries, but you don't find the internal and external elastic lamina in veins. Then the innermost layer, see where the blue arrows are showing the tunica interna, aka the tunica intima. It's the innermost layer, that's where the blood is flowing. That's the tunica intima encloses the lumen of the blood vessel. If the blood vessel gets damaged, then the endothelial cells that are lining the lumen will cause the blood vessel to get narrower so that you decrease your loss of blood. So this is an important concept. The histological classification of the cells that line the lumen is a simple squamous epithelium plus a basement membrane. But because that simple squamous epithelium is inside a blood vessel lumen, you call that simple squamous epithelium an endothelium, made up of endothelial cells. The endothelium is selectively permeable, and we'll talk about this later when we talk about diffusion of molecules across the capillary. But the endothelial cells are selectively permeable. So some things can diffuse through their walls, the endothelial cell walls, and some cannot. Endothelial cells also secrete vasoconstrictors and vasodilators. So if you remember from the hemostasis lectures, endothelial cells are constantly secreting prostacyclin so that platelets won't stick and cause the blood vessel to vasoconstrict. But endothelial cells also secrete nitric oxide, or NO. That's a vasodilator. So endothelial cells secrete a lot of different vasoconstrictors and vasodilators. And for this lecture, we don't have to name all the vasoconstrictors and vasodilators. We just have to know that endothelial cells can secrete vasoconstrictors and vasodilators that will communicate with the smooth muscle cells in the tunica media and tell the smooth muscle cells to constrict or dilate.